The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
Welcome back to AM Northwest. March is Colorectal Cancer Awareness Month, and an estimated 154,000 people in this country will be diagnosed with it this year. Here to share more about risk factors, treatments, and research, we welcome radiation oncologist and cancer researcher with Providence Cancer Institute, Dr. Christina Young. Good to have you with us, doctor.
Thanks for having me.
Let's get right into it. What are some of the risk factors for colorectal cancer?
Yeah, I think that we've learned a lot in the last several years about risk factors for colorectal cancer. Mainly, we think that obesity and being overweight is a risk factor.
Yeah.
Diet is a risk factor. So diets that are high in red meats and low in fiber, fruits and vegetables, those tend to be risk factors for developing colorectal cancer, as well as smoking and drinking.
Okay, and then what are the symptoms? So if someone feels something, like, how would they know?
Yeah, I think the main thing is to be able to sort of be in touch with your body. I think a lot of people will notice change in bowel habits as sort of the first thing that might tip you off to something being off. Blood in your stool, change in the caliber of your stool, frequency of bowel movements, those are all things that you should discuss with your doctor if you notice something that's different. I think other sort of things that might tip you off to something being amiss is really if you have some unexplained weight loss, those sorts of things, those are reasons to talk to your doctor.
I thought I heard too about excess thirst, or no? Not really.
I think that might be related to some other things, but certainly something to mention to your doctor if you notice it.
Absolutely.
Yeah.
And I understand that more and more younger people are being diagnosed with it.
Yeah, it's really something that we've noticed also in the last decade or so, and it's been something that's been really tough to see, just people in their early 40s being diagnosed with colorectal cancer, and it's prompted a change in the screening guidelines.
Why do you think this is? Why the rise in the...
I think maybe it has to do with lifestyle changes.
Okay.
Yeah.
All right. And then how important is screening? And that you mentioned that you brought down the age of screening.
Yeah, screening is so important. I think early detection is really the key to having effective treatments for patients. And the screening guidelines, it used to be that we started screening for colorectal cancer at age 50, but now the recommendation is to start at age 45.
And at age 45, if you get an all clear, then it's not, you don't need to take another one for a number of years, right?
Yeah, so it depends on what type of screening you do. The gold standard is, of course, colonoscopy.
Right.
And if you have a clean colonoscopy, it's often just once every 10 years. And some people don't have access to colonoscopy because of where they live, or it's just a little bit overwhelming to think about the prep and the actual procedure.
Yeah.
There are other options for people who choose not to do a colonoscopy, so you can do different stool tests. The sort of ones that you do at your doctor's office, you do annually. There are some that you might see commercials for between football games and things, and those are kits that come to your door and you provide a sample and you mail it off.
Right.
Those are every 3 years.
Okay, and then what are some treatments for colorectal cancer?
Yeah, so the most common treatments are a combination of chemotherapy, surgery, and radiation. It depends on what stage you are, and really the sort of type colon is treated a little bit differently than rectal cancer, but typically some sort of version of those modalities is often employed.
Okay, so, but the key here is finding it out early, right? That's the key.
Yes, if you find out early enough, you don't have to go through as much treatment or as many modalities.
Wow, okay. And what's on the horizon when it comes to research?
Yeah, that's a great question. I think a lot of the focus now is on reducing toxicity and sort of dialing back the number of treatments or the types of treatments to maintain excellent outcomes but have less side effects for patients.
So are you saying like to back off on the chemo?
So I think, for instance, in rectal cancer, a lot of the sort of movement is that you will have chemotherapy and radiation, but maybe not surgery, or chemotherapy and surgery and maybe not radiation, depending on sort of your response to the therapy. So we're trying to tailor it a little bit more specifically and be able to pull back at least one of the modalities.
Number one advice to viewers out there:
if you notice something different, talk to your doctor.
Yeah, absolutely. All good advice. We're going to tell everyone, if you'd like to find out more, you can contact Providence Health and Services, Providence Resources for Colorectal Cancer Care, ka2.com/Family Matters. Doctor, thank you so much.
Thank you.
All right, we'll be right back with more AM Northwest. Don't go away.